Well, swimsuit season is just around the corner, and it's estimated between 80 to 95% of women have cellulite somewhere on their body. It's something that a lot of folks worry about, especially during swimsuit season. Plastic surgeon Dr. McIntyre Bridges with Bridges to Beauty joins us to talk more about a new procedure to help treat that cellulite. He'll be here answering your questions for the next half hour. We encourage you to ask questions on your mind. If you're online there at KTBS.com, click on that orange Healthline 3 box. It's right there on the right side of your screen, on the computer screen. That's going to take you to our webcast. It streams live. You can take part there and ask questions right there online at KTBS.com. If you don't have internet, you can always give us a call during the show, 318-219-4569. That's 219-4569, the number right there on the bottom of your screen. We'll be taking your calls and your questions until 12:30 this afternoon. Dr. Bridges, as always, great to see you. Thanks for coming in.
It's great to be here.
Let's kind of first of all take it from the top. What exactly is cellulite?
Now, cellulite is a structural problem underneath the skin. I mean, it's in the fatty layer. Okay, it's not extra fluid, and it's not all these other things that you'll hear on the internet or television. It's simply basically the skin is covering what I call a fiber sponge, and all the holes are filled with fat. Now, in women especially, and again, this can be seen even back into the fetal stage and things. The development of the fibrous tissue that holds the skin down to the muscle, okay, that weaves up through the fat, is structurally different. Okay, it's almost like little pillows that come up and things. And the ones that are real strong are pulling on the skin and indenting the skin, and then when that happens, so much pressure is generated from that pulling in that the fat on the sides herniate up. Okay, so that's where you get the hills and valleys. Gotcha. Or you got some people with a grade 3 cellulite that looks like they've been in a hailstorm.
How does it get worse?
Well, we gain weight.
Right.
Okay, the skin gets lax. Those fibrous tissues, as we get older, all fibrous tissue in our body becomes stiffer. Okay. It loses elasticity, so it even tethers it even more.
Really? Who's more likely to get cellulite? Is there any age group that you see more so battling it?
Well, actually, it's all age groups.
Is
I mean, the youngest I've done is someone who is probably in her late teens, early 20s.
Oh, wow.
Okay, and now she had a grade 2, which basically is almost what that was called a mattress pattern as far as the cellulite, where it just looks like little rolls and things. But I mean, it is. I mean, and on up. Okay, it doesn't really tend to run in the family because it's really a structural problem in women of that fatty tissue.
So it's not hereditary?
No.
Interesting. But there's actually a new treatment option out there available for women who do battle, or men in that case, who do battle cellulite.
Yeah. It's called the Cellulite.
Okay.
We purchased it, and we're the only ones in the northern portion of Louisiana to have it, basically in the Arkansas region. It addresses the problem of the fibrous tissue that's tethering down, as well as the bulges of fat. And it does that because it's the same maker that makes the Smart Lipo, which we probably have the strongest Smart Lipo in the region. It's a laser on a stick. Okay, so the fact is it has a forward pointing laser as well as a side port that at 90 degrees the laser comes out. So you have an instrument that basically you can use by turning it sideways to cut the fibrous tissue that's holding that skin down, so it allows it to come up. Okay. And then you turn it at another 90 degrees where it's pointing down, and you're melting the area where the fat is herniating through. And the final thing, since skin elasticity doesn't get better over time, you turn it up and you're warming that skin up to 44 degrees centigrade. And what this been shown to do is increase the amount of collagen, okay, and smooth collagen in the skin, so it actually helps tighten it up.
How long does this procedure take?
It takes about an hour.
That's all?
Maybe an hour and a half, yeah. Most cellulite in most people is localized in an area like this.
Okay.
I mean, commonly it's the lateral thighs and the back of the thighs. Some people have around the knees and stuff, and you can have it other places too, but it's not quite as common.
So you guys just kind of go in with do you inject it through like a needle, or how does that?
Yeah, you make after you've numbed up the little area. Okay. You're making a little puncture wound. It's about the size of a pencil lead. Okay. And you pass that laser through, okay, and it's divided. The areas that you're working on is divided into quadrants, okay, and each quadrant either has little red line which indicates, or a red dot that indicates a place that's been pulled down, okay, and green areas which are bulges, because everything looks a little different laying down, and once you put in that tumescence fluid, it really does look different. So it gives you a map where the strategic areas are that you need to work on.
Really?
Mm-hmm.
And says it takes about an hour. Pain afterwards?
It's more of a bruisey, stingy sore.
Really? Okay.
The numbing stuff will last about 3 to 6 hours, depending upon the person. We do leave those little holes open so it leaks a little bit, but not as much as the Smart Lipo does. Smart Lipo leaks up to 12 hours. This might leak, maybe up to 12 hours, but it's not as much, because you're not really doing lipo sculpting where you're beating up on a lot of fat. It's really that superficial centimeter and a half worth of fatty tissue.
Mm-hmm.
And some people can have deeper, some people can have a little bit shallower, but that's the area that you're working in. You're not really there to kind of get rid of bulks of fat. You're contouring and shaping areas that are causing a skin irregularity.
And is this something that you notice immediate results?
Well, yes.
Once that swelling goes down,
Once the swelling goes down, yeah. Once the swelling goes down, again, the swelling, it can last, anywhere from 2 weeks out to 4 weeks, depending upon the person. But it's not bad swelling. I mean, in the area that basically has been, lazed and things, will feel a little stiffer for a while and things. And as the body cleans up the trauma, like I always tell people, anything I do or any surgeon does, whether it's with a scalpel or laser, it's a calculated trauma as far as your body is concerned. Okay, and we really depend upon the body in its methods of healing to get where we kind of want to go. Mm-hmm. It has to be dependable.
This is FDA approved, of course. How long has this been around?
Well, actually, the machine, in terms of studies, has been around for at least almost 3 years. Almost 3 years and so. It was FDA approved in February of this year.
Oh, so just recently.
Yes.
And then, so the machine, you mean the machine, and so then you guys ordered one, and have y'all been doing a lot of them lately?
Yeah, we've been doing. The main thing is the machine. It's a pretty big machine. It's like a small refrigerator and things. It's that big. But we've been doing them, and I really like the results. People are liking results and stuff. Some of the ones are kind of early on, so it's a little bit difficult to tell. But so far, if you look at the studies that have been done on it, and I went and trained with a gentleman, a doctor in New Jersey and things, DeBertolo. He's got a 3-year series, and it's unbelievable that anything lasts 3 years and stuff. They have remarkable results even out to 3 years.
Really?
And I think it's because you have changed the structural elements underneath that basically cause it, number one. Because you mentioned men that might struggle with it. There's very, 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 very few men that would have problems with cellulite, because structurally that fibrous sponge underneath the skin is not shaped the same as it is in women.
Okay.
In men, the fibrous tissue basically goes up to the skin at an angle. Okay, and so it's not really tethering directly down. Okay?
Right.
When it shortens, it kind of shortens uniformly and things. In women, it has to do with estrogens. I mean, it's more of an estrogen issue. And again, that you can tell those shapes come about even inside the womb. Mm-hmm. Women versus male versus female.
Right.
And so it's primarily a women's issue.
Why is cellulite viewed as such a problem? Is it just the outward appearance?
It's the outward appearance. People say, I don't like to wear shorts in the summertime and things because, around the knees and stuff, it's all kind of wrinkly looking and all. The ones that have that, looks like what I call it, that hail damage look and things, where there's little puncture wounds all over the place, they don't like that.
Right.
Okay? And again, the device basically improves those looks. I'm probably going to end up doing a little bit of fat injections underneath the areas that are dimpled in, because even on the nationwide studies and things, if you look at it and things, there's a vast improvement, but there's still some little bit of areas, where it's dimpled in, not where it's bulged up and things, that tends to be lingering. And I guess being a perfectionist, I was like, well, you just squirt a little fat underneath there just to smooth that out.
That's funny that you have to squirt a little fat in there, and that's what you're kind of taking out, right?
Yes, yeah. Well, you're melting fat and things, but you would gather some fat. You know, we have plenty of things. You know, maybe a little bit deeper in areas, and so it wouldn't take much, like 3 or 4 cc's, to kind of make those things just a little bit better. I think that's probably the way to go with it.
Right.
But those are really the ones that have that. Again, those little almost look like little hail damage type situations. The ones with the master's patterns, you don't have to do that.
The ones with the, you said like hail damage, is it just those are the ones who are more so overweight than others, or?
They can be,
okay,
but they don't have to be. Again, structurally, everybody's a little bit different things. So that fibrous tissue from one person to another person can be more tethered. But typically, if they're a little more overweight, they'll do that. Again, the cellulase thing is not a contour issue in terms of let's say lateral thighs are bulging out. You might need a combination of some liposculpting with a smart lipo, okay, which gets rid of the curve issues, and then also superficially do stuff with the cellulase for the cellulite. They're two different. I mean, you know, if someone comes in and says, yeah, I got these bulky things, but I have the cellulite, you probably need a combination of both, because, you know, liposuction, again, you're just like deflating a balloon, or liposculpting, even with smart lipo, you're just deflating a balloon and things. If that top layer of skin, which you really don't want to bugger up with any type of liposculpting kind of situation, is not addressed, then basically it's smaller, but you're probably still going to have some of that cellulite. I think it improves it a little bit, but nowhere near what the cellulase will do.
Really? So is there anything else that you can really do to treat cellulite, or is it just?
Well, you know, there's other methods that are out there, but they're not long lasting.
Okay.
Okay. They only address more of a skin tightening issue.
Okay.
And so it doesn't release the fibrous bands, which are causing the dimpling. So this is probably the complete package when it comes to cellulite treatment.
So if you want it gone, and this is gone for good, do you have to do follow-ups or anything like that, follow-up treatments?
Well, I do follow-up treatments, you know, just because, you know, I like to do that and things. And number two, again, the longest stay is 3 years. And again, if you have something hold up in cosmetic surgery for 3 years and stuff, that's a gold standard.
I've always heard, you know, when you have a tan, you don't see the cellulite, or, you know, darker skin, it helps cellulite go away, but it never truly goes away unless you get, you know. Right.
I mean, cellulite really is a shadowing issue. Okay, if you throw a little suntan on it, things, I think it'll mask some of that shadowing issue, because it's the dimples that go in. A lot of people get tans to cover up spider veins. That's the most common thing I'll hear about getting a tan.
Really?
Yeah.
To cover spider veins.
Yeah, because, you know, against white skin, the spider veins get easy to see.
You can really see them, yeah.
Absolutely.
Will weight loss help reduce cellulite?
It does improve it.
Okay.
I think it improves it from the standpoint that, you know, those bulges, okay, or herniated fat and things, if you know, reduce those and stuff, you bring it closer maybe to the little dips and stuff, so it truly isn't as noticeable.
Is cellulite related to age?
I think it gets worse with age.
It gets worse with age.
But I've seen some bad cellulite in young people and things, but it seems to get worse with age because of the fact, I think the fibrous tissue that's tethering down that skin, making the dimple and stuff, it shortens a little bit over time, just because it doesn't have the same elasticity it did when we were in our teens.
Right, right. We invite you, if you have questions. Today we're talking with Dr. Bridges about cellulite. Of course, swimsuit season is just around the corner. We invite you to give us a call, 318-219-4569. That's 219-4569. We'll be taking your calls for about another 15 or 16 minutes here on Healthline 3. We actually have Gay on the phone with a question for you right now. Hi there, Gay.
Hello.
Hi, what's your question?
I wanted to know, I see a lot of advertising about this lifestyle lift. I wanted to know if Dr. Bridges has a procedure like that.
Yeah.
I don't want to have to go out of town.
Yeah, I do. In fact, you know, the lifestyle lift, you know, the technique has been around for a while. I mean, I don't think it's anything new. Somebody just put a label on it.
I don't even know what it is. I got some literature, but they didn't explain it.
Yeah, the lifestyle lift, the basic concept is when you're tightening up the basically lower face and neck.
Jawlines and neck.
Yeah. They'll put basically a purse string suture, okay, and then when they pull it, like, you know, you're tightening up a duffel bag and things, it tends to kind of pull things up like this. A lot of techniques do a similar thing. You know,
I'm interested in having that done. Do you make an incision right under the chin where you can't see it?
well, actually, you know, when you do it, it's whether it's a lifestyle lift or a regular facelift, which, you know, they're essentially the same things. You know, you go in front of the ear and behind the ear. You make that incision underneath the chin because there's a natural crease there.
Right.
To tighten up those muscles that tend to kind of poke out. You know,
Right.
if you're looking at someone, they have these look like these little lines that kind of come down.
From the nose.
Well, from the nose, but also underneath the chin region and things, you have, you know, these little things project out, little strands. What there are is little muscle bands.
Right. Well, what I'm interested in the deep lines from the nose down, you know, by the mouth, and then the jowl lines, and then the neck to be tightened up.
Okay.
You do that.
Yeah, I do that and things. Like the nasolabial fold, that parenthesis that goes around the mouth. I mean, a dermal fill, you know, is not an unreasonable thing. I use what's called radius because it lasts about 2 years, if not a little bit longer.
Is that an injection?
It's an injection.
Well, what kind of are you put to sleep to do this?
Not the injection. Now I do numb the air.
The other.
Oh yeah. It's local with sedation. In other words, we give you a little Demerol, a little Versed and things, and most people are snoring through it. They don't move, put it that way. And then you're numbing up that region.
Yeah, I don't want to be put to sleep.
Yeah.
Because I'm an older person, and sometimes you don't have your memory like you need it.
Sure, absolutely.
Well, I'll call your office then and have a consultation appointment. Would that be okay?
Yes, ma'am. Absolutely.
Dr. Bridges, what's your number? at the
Yeah,
office?
it's 318-219-8555.
Okay. Well, thank you so much, Dr. Bridges.
Thank
I
you for
appreciate
calling.
this.
Yes.
Thanks, Gay.
Thank you.
bet.
Bye-bye.
We invite, if you have questions about cellulite, we're with Dr. Bridges, of course, plastic surgeon at Bridges to Beauty. We invite you to give us a call. 219-4569 is the number to call. Reese is on the phone with a question for you right now. Hi there, Reese.
Hi.
Hi, what's your question for Dr. Bridges?
My question is about the cellulite. Right now, I'm in the process of losing weight, and so before having that done, should you go ahead and get to the weight goal that you're wanting to reach, or is it okay to have it done now and still continue to lose the weight?
Now, I'll be honest with you. I think losing the weight is a good thing. Here's the reason. Okay, as you lose weight, the skin envelope, you know, it has a natural ability to contract. And so if you get down to kind of where you want to go, you still have the cellulite and things. Once you do the cellulite, you can get even more contraction of that skin. My biggest worry about weight loss and skin is that our skin just doesn't have the same elasticity it had when we were younger. The cellulite does a great job. Cellulase does a great job in tightening that skin. But if you're already losing weight, I would recommend, you know, lose the weight, then consider the cellulase. You're probably still going to have the cellulite issue, but you know, I would rather have the skin envelope kind of shrunken down in a natural basis and stuff, and then, you know, make it shrink even more with the cellulase.
Okay.
Thanks for
Thank
calling,
you
Reese.
so much. All right. Thank you so much.
You're welcome.
Bye-bye.
Once again, 219-4569 is the number to call if you have questions for Dr. Bridges. We're going to be here about another 11, 12 minutes answering your questions. Does exfoliation help with cellulite?
No.
No.
Again,
No.
exfoliation is basically as you're taking off that very superficial layer of dead skin. There might be a little stimulation that comes from it, things that would affect the dermis, but it's very, very short-lived, if any.
I actually have a question from Mary right now for you. Hi, Mary.
Hi, how are you?
Doing great. How about yourself?
I'm good.
Good.
I have cellulite all over my thighs and my buttocks. So how can we get rid of that, or what's the cost to get rid of that?
Well, it depends. I mean, the cost is, well, the cellulase is probably the way to go with that and things. Do you plan to lose some weight before?
Yes.
Okay. Yeah, like I was telling the other caller, things, losing the weight is probably not unreasonable. You know, some people can't do it as well as others, but the main thing is the charges for it basically is dependent upon the surface areas that have to be treated. Because there's a considerable cost of disposable products that come with it and things. I mean, the laser head itself and things is, you know, it's $1,000 and stuff. But when you're using it, and you know, the best way is really to have a consultation. Let's just see where the areas are and how many of the little treatment areas that we need to do, and that would help us with the cost.
Okay. Where are you located?
I'm located on Uri Drive. It's 4300 Uri Drive, and it's on the same side as Broadmoor Baptist Church, and it's that next group of buildings after Broadmoor Baptist Church, after their parking lot.
Okay, do you have a sign up?
Yes, ma'am.
Yeah.
Okay.
Big Bridges to Beauty sign right there, Mary.
Okay.
All right.
All right, thank you.
Yeah,
welcome.
thanks for calling.
All right, bye-bye.
So, do topical skincare products really help with cellulite, or
No, it's all
really?
topical. I mean, you know, they used to have those aminophyllene creams, things along lines. I mean, that, like all other things that don't work, they just come and go. They get a lot of hype and all. None of the creams address the fibrous structure underneath, and that's
Right.
what you have to do in order to get that shape. If you're going to shape anything at all, like a piece of wood and things like that, you know, you have to address the whole thing in the whole thickness to get what you want from it. You know, painting the surface, if that's what you want to do, is okay, but it's not going to change cellulite.
Where did the term cellulite come from in the first place?
That's a good question.
Oh,
Yeah.
I got one. I stumped you there, huh,
You stumped
Dr.
me there,
Bridges?
yeah. I have no idea, because it has
We'll have to Google that, won't we?
you would think it, you know, cell means, you know, cell, but you know,
Yeah.
this is fat.
Right, there's nothing light about it, right?
Yeah. I mean, I don't know where that came from.
We'll have to look it up after this show, won't we?
Yeah, we will.
Do you find that, do you think it's too late to get this procedure if someone's maybe trying to get ready to get in that swimsuit? You know, May's just around the corner, the hot summer months are just around the corner. Is it too late to get it now in time for the summer months?
Yeah, that's a good question.
To be able to, you know, show off.
Yeah. I think basically, you know, people are going to do it throughout the summer anyway.
Right.
Again, especially the ones that don't want to wear their, you know, that don't wear shorts. Now, if you're in bathing season, then sure, you're going to see it. Unless, you know, I think that basically people are going to have it throughout the year. That's been the trend anyway. But probably more in the spring, okay, in the fall when they're a little more covered up and things than in the summer times.
Kind of talk about, you guys see, of course, we think of plastic surgery, we think of women, but you guys see a lot of men as well getting different procedures done. Kind of talk about some of the popular procedures for men.
Probably the two most, well, there's three that are popular, but the two most is going to be liposuction, okay? And they'll do it around the waist and in the flank regions. Some men will have lateral thigh fullness, but not many.
Right.
We tend to kind of put it in our waist region. Second most common one is breast reduction.
Really?
You know, I mean,
As far as men?
as far as men,
Okay.
yeah. They'll get gynecomastia, and these people can be like, you know, bodybuilders and real fit and things, but they have, you know, extra breast tissue underneath the nipples that when they go put on a shirt and things tend to kind of show through. And then you have that population, in the pediatric population, where, you know, it's even more of an embarrassment when you're going to school and you know, kids aren't kind.
Right.
And so those are two of the most popular ones. After that point, we're talking about, you know, some facelifts, some ears, as far as, like, you know, addressing your protruding ears and then noses.
Really? What about tummy tucks? I guess that would mostly be in women, or
Yeah, I mean, it's rarely to do a tummy tuck in a man and things like that. You know, if they've lost weight, you can do what's called pediculectomy, where you're just taking off that strip of skin that's around there. But tummy tucks are real popular. I see a lot of people who I mean, I do a lot of tummy tucks. You know, and the goal to that really is to all of them are after pregnancy.
Okay.
Okay, because, you know, when a woman's pregnant, there's 9 months where the body's only consideration is make room for the kid, give it some milk. And in making room for the kid and things, I mean, the muscles stretch out. Okay, of course, everybody sees the extra skin and things, and they'll think that basically the extra skin and that rounding forward basically has to do with all skin and fat, and it doesn't. The extra skin is there, and you take that off. But that rounding forward, that kind of lower abdomen or upper abdomen or both, and things, is the fact that the abs is spread apart about the width of a credit card. And so with the tummy tuck, your goal to the tummy tuck is to get all those muscles back to where they used to live prior to pregnancy. And you want to be in a situation where you're not going to get pregnant again.
Okay.
I mean, it's better. I've had 4 people in 23 years that got pregnant afterwards. They made room for the kid. I was surprised how well it snapped back, but you really couldn't promise that.
Really?
Because our bodies, it's going to do what it's designed to do. And its job at that point, make room for the kid, give it some milk.
Right.
So you get all those muscles back to where they used to live and things, and then you take off all that extra skin. And that tightens up the abdomen, gets it back to where it used to live. I do some liposuction with mine when I do the tummy tuck. That's part of the package, and it's usually in the flank regions to get even better curves. But you get the majority of curves by getting the muscles curved back in. It's a great operation. I mean, it's an operation that women really love.
Right.
They don't love it that first week just because they're sore.
Really?
Yeah, it's a very sore operation. I mean, it's the most uncomfortable operation I do, but there's not a woman that I know that wouldn't do it again.
Really? And I guess in all of these, you have to keep in mind, this isn't instant. Very rarely do you see instant results the next day. You're not going to go from a size, 10 to a size 8, overnight. It's
Right.
going, that swelling has to go down.
Yeah.
And
Well, actually, most of them do. And things. It
Really?
just gets even better after that.
it gets better, right? You
Yeah.
might drop a couple sizes, but you're going to really notice the best results.
Right. Most go from, let's say they're a 12. I mean, they'll
Right.
end up at an 8, maybe a bit lower. And
Just the next day.
well, the next day they
I
might
mean,
might be around a 10, maybe
Right.
around that, because there's a swelling. I
Right.
mean, and all those tissues are going to act like they've been beat up on because they have, and so there's always swelling. It's like if you twist your ankle, you might want to go to that dance that night, but you probably can't get in the shoes that you're wanting to wear. So it has to go that transition.
Right.
Your body, we depend upon that. I mean, if our bodies weren't uniform in the way they act and things, the predictability of operations probably wouldn't be that great.
When do you see most women getting their tummy tucks? I know you said it's definitely need to do it after you've had your kids, but is it in 50s, 60s?
Oh no. I mean, we get them in the late 20s all the way
Oh,
up.
really?
All the way up. Yeah. I mean, everybody has their certain concerns about like bathing suit time,
Right.
and what they're going to wear and things, and even though you probably can't get rid of all stretch marks, especially if they're above the belly button, you're just going to move them down. They look 100% better because most stretch marks, when they're mature, when they're kind of lighter and things, the reason you see them is because there's shadowing issues. It's kind of crepey looking, But when you stretch those out, that crepiness goes away, and so it looks tons better.
So you can get rid of stretch marks.
Yeah, you can make them look a lot better.
Okay.
Yeah, I mean, because the stretch marks, initially during pregnancy, they're all kind of pink or blue or something like that. As they mature, because they're dermal tears, and whereas the leather underneath the skin kind of gave way. All right? The skin on top didn't, but it did. And so as it matures or heals itself and things, it goes from the typical, blue to pink, to white. Now, that whiteness stuff varies from one person to another person, but if you look real closely at a stretch mark and things, it has little tiny stripes that run this way and things, so when light hits it, you just see it because there's a shadowing issue. So when you pull that tight, then basically that shadowing issue goes away. And so there's 100% improvement on the look of the stretch marks. Now, if people just have it below the belly button, yeah, you can get rid of all those things.
Right.
Basically because you're taking out everything below the belly button as far as that skin in majority of cases, and then you're pulling this skin all the way down to here. You bring the belly button back up through that skin, but those you can get the majority of those that are in that path out of there.
Right. Dr. Bridges, we have a little less than a minute left. Anything you want to make sure that you really drive home to folks out there who are, getting ready for swimsuit season when it comes to plastic surgery?
Well, like I said, there's many options that you can have as far as taking care of those things that bugger you when you're on the beach. Cellulite is the newest, and it's very, very effective in doing the cellulite. Tummy tucks will give you a good shape. Breast augmentation gives you a good shape,
Right.
And then liposuction in those areas that tend to, we tend to accumulate over time.
And I mean, if someone wants to get one of these procedures done, is it a long wait before they're actually able to get into the office, or?
Well, it really depends. Like the breast augmentation is fairly quick, just because it's not as long of an operation as like a tummy tuck. Tummy tuck's by 2.5, 3 hours and stuff like that. So finding slots for that is a little bit more different than finding a breast augmentation, which takes about an hour. But you need a consultation to know what the ins and outs are and things like that, and especially with the breast augmentation, choosing silicone gel versus saline, because we have two options now. But again, both options are good. They each carry a little bit of difference and nuances as far as what happens over time.
All right. Well, some great advice, and it's been fun talking about this topic. Of course, getting ready for the hot summer months.
Sure.
Dr. Bridges, great to see you. Thanks for coming in.
My pleasure.
That's going to do it for us for Health Watch 3. Have a great day.